If you're dealing with a chronic skin condition, you know the cycle, right? It can be absolutely exhausting. Well, today, we're diving into a really powerful steroid-free alternative that's completely changing the game for long-term skin health.
I mean, does this sound familiar to you? You get a flare-up, you reach for the steroid cream, and yeah, it gets better for a little while. But then it comes roaring back, and sometimes it feels even worse than before. And all the while, you've got this nagging thought in the back of your mind. What is this stuff doing to my skin long-term?
You're not imagining things. Dermatologists actually have a name for this. They call it the steroid trap. And it's this vicious cycle where using steroids for a long time can literally lead to your skin getting thinner. That's called atrophy. Then you get these awful rebound flares when you try to stop, and sometimes it just feels like the creams aren't working as well as they used to. It's a super common and, let's be honest, a deeply frustrating place to be.
But, and this is a big but, what if there was a way to escape that trap? What if there was a completely different kind of treatment that could break the cycle and offer a whole new way forward? Okay, so let's meet our hero, Topical Tacrolimus. You might know it by the brand name Protopic. Now, the key thing to get here is that it's not a steroid. It's in a class of drugs called calcineurin inhibitors. Look, that's just a fancy way of saying it works differently. It goes in and calms down the specific immune cells in your skin that are freaking out and causing all that inflammation, but without all the baggage that comes with steroids.
And this is where it gets really interesting when you put them side by side. You see, steroids work by basically squeezing the blood vessels to cut down on inflammation. Tacrolimus, on the other hand, talks directly to the immune cells. And that fundamental difference leads to the biggest benefit of all: no risk of skin thinning. This is huge. It means it's an amazing choice for long-term use, and is perfect for those delicate areas like your face, eyelids, or groin, places where you'd have to be super careful with steroids.
So, you might be wondering, what is this stuff actually approved for? Let's take a look at its main FDA-stamped purpose.
Right, so the FDA has given its official seal of approval for one primary job: treating moderate to severe atopic dermatitis, which most of us just call eczema. It's usually what's known as a second-line therapy, meaning it's what doctors turn to when other stuff, like a mild steroid, hasn't quite done the trick.
The dosing is pretty straightforward. You've got two main strengths: a lower 0.03% ointment, which is great for kids or those really sensitive spots, and a stronger 0.1% for adults. During a flare-up, you apply it twice a day. But hang on, look at that third row there: flare prevention. This right here, this is a totally different way of thinking about skincare.
And it's called the proactive therapy method. Step 1 is exactly what you'd think. You treat the flare until your skin is nice and clear. But step 2 is the real game changer. Instead of just stopping and waiting for the next inevitable flare-up, you keep applying the ointment just a couple of times a week to those same spots. This keeps that underlying inflammation in check and helps stop it from ever coming back. It's genius.
But believe it or not, its official job for eczema is really just the beginning. Now we get to look at what I like to call the hidden menu, all the other powerful, off-label ways that dermatologists have put this stuff to work.
Yep, because it has such a fantastic safety profile, especially on that thin, sensitive skin we talked about, doctors quickly realized it's an incredible tool for a whole bunch of other conditions where using steroids long-term would just be way too risky.
I mean, just look at this list. It's pretty amazing. It's used off-label for vitiligo, helping bring pigment back to the skin. It's fantastic for steroid-induced rosacea, calming things down without feeding the fire. It's super effective for inverse psoriasis in those tricky spots like armpits and the groin. It's even used for really tough conditions like oral and genital lichen planus. It's like the Swiss Army knife of steroid-free topicals.
Let's just zero in on one of these for a second, because its use for vitiligo has been a life-changing discovery for so many people.
87%. Just let that number sink in. That's a huge number. But what on earth does it represent?
Well, that is the success rate for getting pigment back in vitiligo spots when you combine tacrolimus with either professional light therapy or even something as simple as about 15 minutes of daily sun exposure. It works by telling the immune system to back off the pigment-producing cells, giving them a chance to heal and start doing their job again. It works particularly well on the face and neck.
Okay, so we know it's effective, we know it's versatile, but is it safe? Let's get right into it and talk about the side effects, the warnings, and what the future looks like for this treatment.
So here's a kind of weird one: the alcohol flush. For a really small group of people, we're talking only about 3 to 7%,
Having a drink can make the skin where you applied the ointment get a little red and warm. It's totally temporary, and it usually goes away as your body gets used to the medication. But it's definitely something to know about. Now, the most common thing you might feel is a bit of burning or stinging right when you first start using it. This is totally normal. It happens to about 7 to 20% of people, and the good news is it almost always goes away after a few days as your skin adjusts. And of course, there are some important warnings. You really shouldn't use it on any active skin infections, and if you're pregnant, it's one of those things you need to carefully weigh the pros and cons of with your doctor.
All right, we have to talk about the elephant in the room, the black box warning. On the packaging, you'll see a mention of a potential, very rare risk of lymphoma. Now, that sounds incredibly scary, I get it, but it's so important to have the context. That warning was based on data from people taking this drug orally in super high doses to prevent organ transplant rejection. When you use it on your skin, the amount that gets into your system is tiny. And as the source material points out, after more than a decade of use, the long-term data for topical use is very reassuring.
And this story is far from over. The science is still moving forward. Researchers are looking into all kinds of new possibilities, like testing higher strengths for really stubborn psoriasis, and even using cool nanoparticle technology to get the medicine deeper into the skin with even less of it being absorbed into the body. The future for this therapy is definitely bright.
So, after going through all of that, what's the one big idea you should walk away with? Well, it's really about a fundamental shift in how we think about managing our skin.
Here's the bottom line. It's about shifting your mindset away from just reactively chasing flares, putting out fires as they pop up, and moving towards a proactive model of actually maintaining clear, healthy skin for the long haul. It's about taking back control and focusing on prevention, not just treatment. You see, this isn't just about trying a different tube of ointment. It's about adopting a whole new strategy for your skin. It's about finally getting out of that steroid trap and finding lasting, proactive relief. So the real question is, are you ready to talk to your doctor about what that new strategy could look like for you?